Admiral Rachel Levine, who served as the 17th United States Assistant Secretary for Health, the first transgender person to ever receive the U.S. Senate confirmation, and before that, she served as Secretary of Health in Pennsylvania. Now, as she takes the stage, what I want to say is I had the privilege of being in HHS for her first community meeting. And I will never forget that moment, because working in the Assistant Secretary of Health's office, she didn't necessarily need me to prepare talking points on how to communicate with our community. She stepped into that Zoom call, because we were still during COVID, and I watched the community light up and glow as she was able to speak to the community in a way that they understood. She was able to convey caring, compassion, as well as the administration's priorities. So please welcome to the stage Admiral Rachel Levine.
Well, Harold, thank you so much for that wonderful introduction, my dear friend, Harold. And good morning, USCHA. Good morning. It is absolutely wonderful to be here with you and to be joined by some amazing colleagues, the unbelievable Dr. Fauci and others at this plenary today. Thank you. So, you know, I began my career in pediatric medicine in 1983 in New York City at Mount Sinai, and I saw many patients in the early days of HIV/AIDS. I want to talk about something that Harold mentioned, and that is the incredible dedication of the HIV workforce. The HIV care workforce since that time has been incredibly dedicated, with many people working for decades and dedicating their professional life to caring for people living with HIV and working to end the HIV epidemic in the United States and around the world. We applaud you. You're in this room. We applaud you. Applaud yourselves. For your dedication and for your passion. And we know that there are shortages in HIV care, and it is so critical at this challenging time that has been discussed that we support you, the HIV care workforce. I do want to say a few words about the challenges facing our public health workforce right now. Many dedicated public health leaders, including most of the HIV and infectious disease team who I worked with in my office of OASH at HHS, have had their positions eliminated. Many are still working for work to this day. These hard-working civil servants went to work every single day to support the health and well-being for all Americans, including those living with HIV. I want to encourage each and every one of us to thank our public health workers, our HIV prevention and care workers, our scientists and HIV researchers. The work that they do and you all do is so deeply important to the health and well-being of the American people, and you have, all of us, our immense gratitude.
Dr. Levine, in the early days of the HIV epidemic, you mentioned you were in New York and doing pediatric work. What stands out for you about that time?
Well, as Dr. Fauci was talking about, in terms of the development of delineating the HIV virus and then proving that and then testing, you know, I was a pediatric resident at Mount Sinai in 1983, seeing children, newborns, children, and adolescents. So what we first saw, right when I started in July of 1983, were newborns with unusual opportunistic infections, like PCP and other infections. And coincidentally, their mothers would be diagnosed with opportunistic infections. And in my experience, all of those patients tragically passed away. Sometimes their fathers were diagnosed and passed away. I saw teenagers that had HIV from many different causes. And at that time, in 1984, 85, they all passed away. Of course, friends and colleagues in New York City who would develop HIV, and they would pass away. And so it was such a poignant, difficult moment to be a trainee in New York. And then we had AZT as the decade progressed, but really not definitive treatment, as Dr. Fauci was saying, until the 1990s. So that really what shaped my experience of HIV/AIDS at the beginning. Right now, we have what I would have thought of in the 80s as medical miracles. Now, thanks to Dr. Fauci and many others at NIH and many other researchers throughout the country and throughout the world, we have these medical miracles. We have PrEP. We have daily PrEP or injectable PrEP that will prevent people who are at risk from getting HIV. Imagine that in the 1980s. We have once a day ART. People will be U equals U. Undetectable equals untransmittable. Please, a hand about that. And from the 80s, again, a medical miracle, and potentially more medical miracles to come if the funding is there. But the key to ending the HIV epidemic now is rooted in health equity. We are not really getting those medical miracles to the people who need it most in cities throughout the United States, in rural areas, American and Alaska Native tribes. It really is getting those medical miracles to the people who need it most, in communities of color, LGBTQIA+ communities, and many more. And that was the goal of the Ending the HIV Epidemic initiative, which is so critical. I think that this is absolutely possible. I think that we can end the HIV epidemic in the United States and eventually globally, but it's going to take all of us working together, all of what Harold mentioned, and it's going to take the continued and expanded funding to do that. And that's why we have to stand up and all work towards that end, which we know is possible. Thank you.
Thank you.